UNAIDS is the United Nations joint effort on AIDS. So it's the entirety of the whole UN responding to the AIDS response. So what we do as the United Nations, and I won't like to just say UNAIDS Secretariat, but in our entirety what we do is to make sure that the response to HIV and AIDS is focused, is on target, and is doing the right thing. So what we have to make sure is no one is left behind, for example. We have to make sure that we address all inequalities in order to end AIDS by 2030. So what we are doing, especially what we are going to do in the coming years, is to ensure that we close the gap by addressing the inequalities and leaving no one behind to end AIDS by 2030. We do this through high-level advocacy. So you see us working with the presidency, with the Office of the First Lady, for example, with parliamentarians, with civil society organizations, with all the line ministries, with the traditional leaders, but it's high-level advocacy to ensure the response is going in the right direction. And another thing that we do is to provide technical assistance. We happen to have a lot of expertise in UNAIDS globally, regionally, and nationally. And we provide technical assistance to inform programming around HIV and AIDS. Another thing that we do is resource mobilization. For example, when it comes to refurbishing the Global Fund, we are part of the full partnership that makes sure that the Global Fund is well funded, but also the national responses are well funded for sustainable financing to ensure that the response goes on, and we also end AIDS by 2030. Another thing that we do is strategic information. We generate the information, but we also disseminate the information. So we are like the knowledge hub as far as the HIV information is concerned. So anybody who would like to know anything about HIV, we would be the first port of call in order to inform your programming. We also provide some catalytic funding. The catalytic funding is really targeting innovative programs or interventions that gives you the proof of concept that then informs a national program. We have done lots of these, and we have really proven to nations that a lot can be done, especially now around inequalities. We work very closely, for example, with the National AIDS Council in Zimbabwe, which is the major coordinating entity for the AIDS response. But also within the United Nations, we are the ones who convene and coordinate what the United Nations is doing towards responding to HIV nationally. And one thing that we are trying to promote right now is to ensure that going forward, the communities are not only receiving services, but they are leading the service delivery. They are leading in the AIDS response. They are leading in prevention, in treatment, in care and support, and as well as making sure nobody's left behind. You know, when we were in 2016, we came up with a strategy which was fast-tracking the HIV response towards ending AIDS by 2030. And what we wanted to make sure was by 2022, 90% of people are on treatment, know their status. So they go for HIV testing and they get to know their status. 90% of those who know their status are on treatment. And 90% of those who are on treatment have a viral load that is suppressed. So that means they cannot easily infect others and they cannot easily get to the AIDS stage. So they are really the drugs are really being effective to protect them. And right now, for example, in Zimbabwe, we actually reached we call it the 1990 targets. But in 2021, we sat back globally, it's not just in Zimbabwe, and we said, so what is missing? If we are all going towards the 90, how can we make sure that we go beyond the 90, we go to 95, at least by 2025, so that come 2030, we are at zero new infections, zero discrimination and stigmatization, and zero deaths. That is, AIDS is no longer a public health threat. So we said, so what is missing? We did a lot of analysis, and we ended up agreeing that the only thing that is pulling us behind in achieving our targets of 95 to end AIDS are the inequalities. Inequalities that are driving the epidemic in a direction where we should not be going. So until we address the inequalities for adolescent girls and young women, until we address the inequalities of the populations that are most at risk, for example, the key populations like female sex workers, we all know that when you have multiple sex partners, you're more exposed to HIV infection, so you should not be left behind. We are talking about populations like men who have sex with men because of the whole nature of how the relationship is. They should not be left behind. We are talking about adolescent girls and young, let me call them adolescent children. For example, in most countries, you hear that adolescent girls cannot access services on their own, and they have to get permission from their parents. And yet we know that they have already sexually debuted. So how can you be sexually active, but you cannot access services that can help you avoid getting HIV infected or getting unwanted pregnancies or any other sexually transmitted infection? So until we get over these structural and social barriers which bring about the inequalities, which is, in my understanding, the biggest gap right now in 2021 going forward, then it will be very hard to see the end of AIDS by 2030. So the gap is addressing inequalities, structural and social barriers that make people not access services, that end up violating human rights, as well as making, for example, adolescent girls and young women not have the agency to make decisions about their own bodies and how to protect themselves. No one is safe until everyone is safe. This is not just for HIV, it's even for COVID. No one is safe until everyone is safe. That's why I'm wearing the mask. So going back to the call to action for HIV and AIDS, until we make sure that we address the inequalities, until we make sure that no one is left behind, that we shall not be able to end AIDS by 2030. So let's end inequalities. Let's leave no one behind. Let's end HIV by 2030.
I'm committed to helping women access justice and better health care as a he for she ambassador.
And so, today, I urge you to join me and others to ensure a safe environment for all women.
Well, the concept of gender obviously refers to the roles that, people play in society, or the norms that are set out for different men and for women differently. So when it comes to HIV and AIDS, you find that women may be treated differently when, let's say, for example, somebody is positive. They may be treated differently. The stigmas that they face might be related to or assumed to relate to things like promiscuity, But with men, you'll find that it might be considered differently. And actually, you find in a lot of African countries, it comes down to saying that a woman has been promiscuous, but when it comes to a man, he has been infected, and a lot of the time women are the ones accused of it. Now, you also have issues from a social economic point of view and a political point of view, where women are not people who are necessarily in the decision-making spaces. So when it comes to policy making, you might find that the policies are skewed in a very patriarchal way. When it comes to access to health services, you may find that it's harder for women to access services because of the gender roles that they play at the home. Maybe they don't have time to go to the hospitals, or maybe they're discriminated or only access it when they're pregnant rather than access the services when at any given time. You might find that in cases of men don't necessarily want to go and seek health services. In fact, men seek health services less than women do. So from a gender perspective, so long as it's not paid attention to or addressed as a gender issue, or services are not gender sensitive and paying attention to both genders, you do find that there is discrimination that plays out, or even stigma that plays out amongst the population. Well, when policies are made around sexual reproductive health services, for example, you will find that, and from a policy point of view, maybe they're not taking into consideration a woman's decision around her own body. So you'll find that policies might be skewed towards just looking at as a woman as a producer of children, rather than her needs and her other sexual health needs. That may not be something that they want to discuss in hospitals, or they don't want to discuss it because it's taboo socially. So you will find that policy can also follow that route, where if it's a conservative situation or a conservative group of people who are making policy, it might then eliminate the needs of women, so long as women are not at that table making those decisions as well. So UN Women, we have really paid attention to supporting women's organizations of women living with HIV. So we find that in communities, women are doing extremely good work, and they are organizing themselves, but they may not have the capacity or the skills to access funding or to have policies that they can develop or to organize even themselves. So we support them from that point of view. We support women's organizations from that point of view. But we've also been very active in participating in the National AIDS Strategy Plan 3, and also the National AIDS Strategic Plan in development of the National AIDS Strategic Plan 4. So those are two really important policy documents and frameworks for the nation that we've engaged with. And the other part is bringing women to the table in the development of the Global Fund 2021 to 2023. You would have found that women are not at the table, or women's organizations are not at the table in deciding what should go into the fund or what should be funded. But this has given the opportunity for them to engage in that process. What we have done there is actually support them by giving technical and financial support to develop the proposals, giving them the money or getting money so that we could have consultants to help them build their strategy and the position that women are taking around HIV, and those issues being included in the Global Fund proposal. So bringing women to the table, I guess, is the big point, and helping them become decision makers in any structures that do exist that address issues of HIV. You still have capacity gaps. You have from from the small CBOs or community-based organizations all the way to the policy level, where you find that we have to improve the capacities of women's voice. Enabling women's voice, whether it be in government structures, whether it be in civil society organizations or as activists. So we find that that is one side. The other side is that stigma and discrimination also still persist in society against women living with HIV. So we are trying to address these issues both from a policy point of view, from an institutional strengthening point of view, and also from the capacity strengthening of civil society organizations and women individuals with knowledge, closing the gaps around language and access to information, which is also a big thing, where a lot of information is developed in English, and the translation of this information for people to access knowledge then becomes a problem for us and for women. Issues around sexual health and reproductive rights is also one that needs to be addressed, so that the integration of HIV positive or HIV affected and sexual and reproductive health access is also something that needs to be addressed and dealt with from a national perspective, as I said before. I think a big part of it is investment. There has to be appropriate investment around gender issues within the HIV narrative. If you only just talk about HIV without including the other issues such as the socio-economic and political spheres that need to be made gender sensitive, then we're not really making any gains. So we now have to make sure that from a gender perspective, the investment is around the integration of gender and HIV, gender sensitivity and HIV. If we have that in place, then we are making gains of equality, breaking down the issues of stigma, and also increasing the access for both men and women equally, both services, knowledge, and decision-making spaces.